Would you rather struggle figuring out your patient's diagnosis or struggle figuring out the best treatment plan for your patient?
All right, so I'm going to base this again off of the confident exploring. So I feel like you would probably rather struggle with identifying what the patient's diagnosis is, just because, like I said, exploring, you have all these different labs and tests and things that, you know, you have at your disposal. So you'd be more comfortable going, well, we don't know what it is, but we have, you know, all these different tests that we can do to figure it out and kind of. But yeah, that would be my reasoning.
And you would be correct.
Yay.
Yeah, I feel exactly. It would be kind of embarrassing to struggle with a diagnosis being a doctor, but also there's so many things you can consider. You can ask people for help and all of this. And in my mind, a doctor's primary job is to help provide treatment. And I would be very upset with myself if I was just struggling with that and not being able to give care to my patient. Just very simply. For Vanessa, I actually picked struggle with diagnosis as well, because I see because she likes inferring and reasoning, and I think this would give her like the opportunity to get the wheels going and practice medicine, basically. Is that wrong?
I don't see it. I struggled with this one because, like you said, like that would work. But on the other hand, I feel like sometimes the patients would rather just know what's wrong with them for their sake. So at least being able to give them one answer, and then I feel like probably the treatment. I'd rather struggle with the treatment because then it's, you know what it is, and you have resources. You know, you can talk to the patient and be like, okay, this is what you have. Here are options. Some of this might not work for you, but then you can reach out to people across the globe that specialize in that one diagnosis once you know what it is, and kind of see, okay, what are we doing for this? Or figure out, okay, this diagnosis has such and such pathology. What other things with a similar pathology can we look at for those treatments to see where we can target? So I think I'd rather struggle with the treatment.
You gave a very NITI sort of like explanation for that. So maybe, hey, Angie, you probably got the cognition right.
Yeah.
Yes, finally.